These are my disclosures. Apart from research support by Positrical to our department, I have to disclose that I received some very nice Swiss chocolate recently from them. There are some general considerations if we consider the possibility to run such dedicated systems in the future. And I think in the end it comes up to two different possibilities. Get the cheap ones or the expensive ones. We might come into situations in which we have less space than we have now, so which would require systems which are just smaller in terms of the dimensions, and of course then also be cheaper, which would allow these systems to be applied to larger parts of the population. And then on the other hand, there's of course also this interesting possibility to make things better than we are used to have it now, so better in terms of sensitivity or resolution, which would allow potentially to come to a better and even earlier diagnosis in the future, also potentially to further reduce scan time or tracer doses. So these are two sides of the coin, I would say, to have these easier, smaller, better affordable systems, and on the other side getting a higher quality. Dementias, as we all know, this is a term for a group of diseases. Alzheimer's disease representing the most often cause of dementia in our societies, but we also face patients with vascular dementia, frontotemporal dementia, Lewy body dementia, and other disorders. And if we discuss tracers, which we are currently using and which we will hopefully be able to use more often in the future, because the drugs are coming now to treat certain conditions, are FDG, amyloid tracers, tau tracers, dopaminergic tracers, neuroinflammation tracers, I forgot. They are also very important, I would say, in the future, and others. And of course, we hope that sooner or later we will also have alpha-synuclein tracers. This is also, of course, extremely exciting as a topic of tracer development in the future. There is an urgent need for more capabilities, more scan times in terms of dementia patients. Why is that so? This is because, as said before, drugs are coming. We will hopefully have also in Europe an approved antibody available to treat amyloid pathology in Alzheimer's disease. And if we translate the FDA approval to the European situation, hopefully we'll see as an approval which requires the candidate for the drug to undergo a test before it gets prescribed with the drug, and a test for amyloid. And PET imaging is the best technique to provide this biomarker information on amyloid positivity in these patients. And of course, imaging and fluid biomarkers of amyloid pathology are of course also able to give you an objective biological outcome in follow-up. So PET imaging and CSF and potentially also blood sampling in the future can also be used for therapy monitoring on a biological scale. So it is estimated that even in a situation in which, like potentially in Germany, CSF sampling will play a major role in this context, up to 1/3 of these patients either refuse CSF sampling or have contraindications against this, or have inconclusive results. So these are all candidates, I would say, for amyloid imaging. So there are estimates published predicting that the demand, for instance, for amyloid imaging will dramatically increase in the future. So if we come back to brain-dedicated PET systems, there, as I have started already to discuss, there are different design strategies. There's this field of groups working on standalone PET systems, and other groups are working on inserts which you can put into an MR system, for instance. And if we talk about the geometry of these systems, there's this conventional concepts and unconventional concepts. I will show some examples in the next slide, which gives you an overview on historic examples in terms of dedicated brain PET systems. The HRT system might be known to some of you, but interesting is that there's also development of having mobile systems like this mind tracker shown here, which you can apply for instance, research applications, and this is mobile, so the patient can walk around with the system. Quite interesting for studying the effect of certain movements, for instance, on brain metabolism. There's this interesting project going on in the States, which is based on the United Imaging total body technology, in which these neuro explorers, or a dedicated system for the brain, is developed and currently tested in a joint initiative by people from Yale University, UC Davis, and United Imaging. And last year at the SNM meeting, a first FDG image of a human patient scanned with this Neuro Explorer was shown, and I hope that you share my excitement on the quality of these images, because now it's getting really possible, for instance, to discriminate certain parts in deeper brain structures, like here in the midbrain, also in the cerebellum. So this is really exciting and a further step forward in terms of resolution and also sensitivity of these systems. So it looks like by applying these systems in the future, we will be able to get molecular information also on much smaller parts of the brain, which we were not able to image reliably so far because of the limited resolution of PET as a technology itself. There's another interesting project done by Chibran Katana in Boston. He's developing together with his group an insert which he plans to insert into a 7 Tesla MR system. And this system has a spherical geometry, as shown here on the left side. And by having this special geometry, you, as you can imagine, achieve an extremely high sensitivity. So you collect much more events as compared to a standard PET system. So this is, I would say, also very exciting. And I haven't found any images so far from human subjects. But again, there's this idea by putting this spherical PET scanner into a 7 Tesla MR to further increase the resolution, and not just in terms of spatial resolution, but also temporal resolution. So that would allow us to get, for instance, dynamic images in much higher temporal resolution, coming to better kinetic modeling, for instance, as one application I can imagine. So likewise, a very promising development. We in Leipzig are currently in the lucky situation that we can do a first-in-human study on a brain-dedicated system, which is shown here, which was developed by Positrigo, a company in Switzerland. And the idea here is to come to an affordable, compact and versatile system which doesn't require much space, which is quite comfortable to the patients because they don't need to lay down anymore. You can sit in this chair, and this is really appealing to us, and we are currently, as said before, doing a first-in-human study, and this was followed by phantom measurements. On the top part, you see results of this classical NEMA phantom, in which a scan time of 15 minutes was sufficient to get resolution up to 1.5 millimeters according to this image. And also the typical NEMA measurements were done with great success, and we also recently have done a phantom brain measurement as shown here in the bottom, giving us really nice quality images. So these preclinical data were quite encouraging, and as discussed already, we now recently started to do a bicentric study in Zurich and Leipzig. This is going to be a prospective trial started some days ago. And the hypothesis which we are testing in the study is that this positron ecosystem is non-inferior as compared to our reference standard PET-CT system. We are also in parallel asking the patients and also the technologists for their comfort and practicability of the systems, and we are testing different traces. And I'm very proud and very happy that I can show you some first human data of the system, because we were quickly after approval of the study doing some initial scans. Starting with an FDG PET scan. This is was done as part of a whole body protocol in an oncological patient without evidence for brain metastases. And the special situation in Leipzig is that we have the Quadra as the reference standard, which is quite harsh comparison, I would say. But that's how it is, and you see here in the FDG images, and that was done after injecting 105 megabecquerel on the Quadra. That was a 10-minute scan, and on the top the respective neuro-LF images, which were acquired on a 15-minute scan. And I hope that you share our initial impression that the images are rather similar and would lead to very similar clinical diagnosis in this patient. So this is very, very nice and very exciting. And then we quickly went to other tracers. Here an example of a tau study in a patient with a very low pre-test probability of being tau positive. So in keeping with that, the clinical question, we did not see a specific tau accumulation of the tracer on the Quadra scan, so this scan was considered as tau negative. And in accordance, the neuro-LF scan again scanned for 15 minutes was also considered being tau negative. Different to the second tau patient which we were able to scan so far. This was a lady with the clinical diagnosis of PSP, progressive supranuclear palsy, which is a so-called 4R tau pathology disorder in which the tau typically accumulates in the basal ganglia and in the pallidum of these patients. And again, in accordance with the clinical diagnosis, we saw pathological uptake of the tracer in the basal ganglia area. And also also in certain parts of the midbrain and cerebellum, and again a nice, very similar uptake pattern was found on the Positrigo scanner. So this is all very nice, and in the end, and this is now we call it a stress test, because for certain circumstances this amyloid scan was done after injecting only 50 megabecquerel of the tracer, which is sufficient for the Quadra scanner, because this scanner is so sensitive. For those of you who are used to reporting on amyloid scans, this is a negative scan, because we only saw the white matter uptake, no uptake in the gray matter, so clear-cut negative scan. And surprisingly, after a long time, very low activity remaining in the brain after all these hours of waiting for the patient on the Positrigo scanner, we again saw only white matter uptake. So again, a very comparable result in terms of comparing the results of the neuro-LF scanner against that of the reference scanner. So we are extremely excited, and I'm very happy that my team and me, we managed to get these first patients scanned for this conference. So it's the first time ever that we shared these images with you, and I hope that you are able to reproduce my impression that apart from the fact that there are different design concepts and different aims you can achieve with dedicated systems, this is exciting development, especially in dementia patients, and this might be really the answer to this higher demand which we might face in the future in terms of dementia imaging. There is progress made in designing and testing these systems, and there's initial evidence in Leipzig for non-inferiority of the system we have tested. And I think this is really an exciting concept, and I'm happy to discuss it further with you. Thank you for your attention, and thanks for this fantastic collaboration with Positrigo and to my group in Leipzig, and thank you for your attention.